I am very excited, right? In the era of personalized medicine, there are so much, we are all part of the healthcare and life science ecosystem. And with that, we're all trying to align more closely to patients' preferences, patients' circumstances, and patients' values. And there is even a role for technology to play as an enabling factor in that. And today, to have a dialogue around that very topic, I am very excited to momentarily call up a panel of experts who are representatives across much of the healthcare and life science ecosystem. And we're going to talk about personalized medicine, some of those barriers, how we can overcome some of those, and even talk a little bit about the ever-changing and ever-increasing expectations in this space. So with that, please, let's introduce our panelists to the stage. Please, join me. Please. I think it's safe. I think we're here. We're good. All right. So let's first start off maybe with a round of introductions. Maybe introduce yourself and to keep it a little exciting, a little bit about your organization and maybe something exciting that you guys have launched or generated in the last 24 months or so. And let's start with you, Richard.
Oh, great. Hello, everyone. Richard Clark, the Chief Analytics Officer at Highmark Health. So just a brief snippet on Highmark. So we're what we like to call a blended health organization. So large blue-branded insurance company. We own a health system in Western Pennsylvania, have a national dental business as well as stop-loss company, and then finally a technology platform that we sell off to other carriers to run in. I would say a bunch of things we're really excited about, but I'll keep in the theme of being here in Las Vegas and just reference the exciting partnership that we announced yesterday with Highmark Health, Google Cloud, and League to launch a My Highmark digital experience starting 1/1/2023 that is part of the name here is going to be very personalized, and hopefully we'll get to talk about that a little bit.
Great, thank you.
Hi everyone, I'm Leslie Fent. I lead one of Roche's, the pharma company, first digital health program or software as a medical device program. So I always explain it to people, I don't just build the product, but I have to build the company around it within the context of a huge, a pharmaceutical giant that's been around for 125 years. And something that was very exciting for my team last couple of years is that we were in the late stage phases of product development when the pandemic hit. And so ophthalmology actually is the disease area that's seen the biggest drop of visits during the pandemic. You can imagine it's elderly patients, so they really didn't want to come into the healthcare, to the healthcare providers. But the challenge is that these are patients with retinal diseases that are threatened to go blind. And so we accelerated the development of our solution, which is a self-monitoring solution for patients with vision impairment, and implemented it in the world's biggest eye hospital, Moorfields Eye Center in the UK to great acclaim. And actually now we're expanding into other sites, and was just a really great use case to show what digital health can do.
Hi, I'm David Tsay. I'm the Chief Medical Officer for Q Health. And at Q Health, we are a health technology company whose mission is to empower users to live their healthiest lives. And our Q Health monitoring system is a diagnostic platform that enables rapid and accurate molecular testing anytime and anywhere. We recently launched a Q Care service, and with that, we're closing the test to treat care paradigm by allowing and enabling our users with positive tests to be able to see a physician immediately via telehealth and then get prescriptions delivered to their doorstep within hours, all in the same day. So on market, we have a FDA authorized COVID molecular test, which has helped millions of people in the pandemic to date. And we're just really excited as we look to the future towards bringing comprehensive diagnostic-led healthcare.
Thank you.
Hi, I'm Eric Harnisch from Mayo Clinic, and As you know, Mayo Clinic, over 150 years old, has had and pioneered this integrated care model. That integrated care model serves 1.2 million patients a year, but that doesn't mean that everybody can get the same care that Mayo Clinic has knowledge around. And so 3 years ago, Dr. Ferge, our current CEO, launched what he called platform business thinking at Mayo Clinic, and that was really, how do we think about building an ecosystem of organizations, providers, companies that are building solutions to enable healthcare transformation. So that's the journey that we're on, and I think this is a great topic. Probably one of the things I'm most excited is we've been working with Google on federated learning and sort of thinking about how do you protect the privacy of data, and I think that's really important when you start talking about genomics, because I'll ask the question at the end, what does DID in genomics mean? And we'll see if two people have the same answer.
That's true.
But that's some of the challenges that we face.
Well, so since we're talking about definitions and having different answers, before we maybe move on, let's first discuss, or maybe level set with the audience, how do we define personalized medicine? Is it different than precision medicine? How does your organization look at that? And let's go down, maybe starting with Eric first.
So Mayo uses the word personal medicine, and that's because we view it as sort of a holistic view of all data. When we think of precision medicine, it's really omics data. So we use personalized.
Yeah, I think I would very much agree with that. There's genomic and proteomic data, but as we think about, personalized medicine, it really is about the actionable health data that is personal to you. And now I think those data fields really expand beyond just, proteomics and genomics in that traditional definition, but it goes to, wearables data, diagnostic data, physiologic data, wherever that data is captured.
And just to throw another term into the mix, my company actually likes to refer to it as personalized healthcare. And we've had, this evolved in our company. And so actually we thought of it as inversion. So personalized healthcare in our company 1.0 was the idea that you had breast cancer patients with a certain mutation, and then you have a targeted cancer treatment for that type of patient population. And then 2.0 was very much around big data, genomics, and leveraging that and more like tumor profiles, and then matching that to the right combination of therapies as well. And where we are now, I guess it's probably 3.0 by now, it's really expanded. I would say the former two, you could still put equivalent to personalized medicine, as in optimizing treatment based on the biology of a person or the biology of their disease. Now, as we kind of think about personalized healthcare 3.0, it's very much about let's go beyond this treatment idea into monitoring, into diagnosis, into prevention eventually, or prevention of recurrence, and really stop compartmentalizing all parts of the care. And that shifted us. We still have a very strong focus on oncology and genomics and that sort of thing, but we expanded that much more into digital health most recently.
Before you answer, I also want, do you use that terminology internally or externally as well?
Both.
Really? Yeah. Okay, very interesting.
Yeah, let's say I agree with a lot of what you said. I don't think at Highmark Health we've been as formal about our phases necessarily, but has definitely evolved in a similar way, starting with precision medicine, really around, information around genomics and proteomics to inform specific treatment pathways. But really now our, at Highmark, terminology would be personalized health journeys. And we've really framed that around kind of a biopsychosocial model that is saying what are all the things we need to know about a person very early on. And for us, it's really in some ways about building the trust between our platform and our consumers, so that when they're engaging with us, whenever they do need us for something, we kind of have their trust, because they feel like they know us and they've been on the, I would say, longer journey than necessarily maybe just an individual treatment or individual health event.
So now that we've established, right, that we are talking about personalized medicine, I don't know what version, right, but we're talking about personalized medicine. I'll maybe direct my first question for David. I know that Q Health was, very keen to embrace the cloud. So, what barriers do you think the cloud can reduce to fulfill the vision of personalized medicine that we're kind of defining here on stage?
Yeah, it's a great question. From my perspective, really cloud computing, and it really serves as a backbone for diagnostic data like the ones that we provide on our platform. And it really can start to do away at those traditional barriers and friction of consumers not being able to access their actionable healthcare, in real time. So I think that we need to, what's amazing about it and why we've embraced the cloud is to be able to do this in a very scalable way, but in a way that also preserves privacy and security, right? These are essential things that we need in order for our users to be able to access their data and also develop that trust, as you said.
Wonderful. And Leslie, maybe perhaps you can share something from a Roche perspective.
Yeah, so I would definitely double down on flexibility. We are experiencing an onslaught of data, new data streams, and just the ability to respond to any kind of size, data privacy, of course. For me, it's also a lot about our vision of personalized healthcare can only be realized if we really manage to generate the right insights from all the different data sources. And so that's I think, for that, the cloud is uniquely positioned to achieve that. And so I think a lot about integration as well, and really generating, not just storing, processing, but really analyzing and garnering these insights.
Yeah. Absolutely. So, Eric and Richard, I'm hearing a theme around, scalability, around data. So based on the last decade, and perhaps maybe specifically the last couple of years, what do you think needs to actually change in a hospital setting or in a payer setting to make global sharing of data and the scalability actually possible?
Start?
All yours.
So I think maybe three things. One is standards. We need to think about, I mentioned DID, and sort of consent management has to follow with that. The second thing is, I think we have to figure out how to make it meaningful for the clinician. Like, they get a report, what do they do with the report? Thinking about that training that they need. And then I think lastly is, what's the infrastructure look like? I think Mayo's in a unique, lucky spot where we have been doing this for several years, but not all institutions have just the core infrastructure to do that. So you need to solve the infrastructure problem as well.
Yeah, I agree with those three. I think that's right. I'll just build on that with maybe two more that I would see from particularly from a payer perspective. I would say one is, there is a culture where I think data sharing has been very challenging, and there's lots of good reasons for that, and there are good questions that have to be asked around, the consent that you managed, around what legal agreements need to be signed. And I think the entire infrastructure, though, feels at times that it is set up to be slow and make no maybe the default answer, which obviously is challenging. And I think we need to just keep pushing on that to say, well, especially if you're taking a platform mindset, how do we push past that to enable the best outcomes for our members and our patients? And then the other thing that I would just amplify, I do think for us at least, is we thought deeply about trying to integrate into, in particular, clinician workflow. That last mile, especially with the EMR systems, has been a challenge, and I think needs to be solved in terms of what that interoperability looked like, because it's great to generate the insight, and I agree that the cloud is tremendous in terms of generating, but they have to get wherever they need to be to influence the care. So.
So I guess maybe to continue that thread on that point, Leslie, I have a question for you. So we've shared some conversation on how technology can be additive to specifically the portfolio that you're spending your time on. What advice do you have to technology providers that can contribute towards your respective industries on realizing that personalized medicine vision?
Wow, I was hoping for your advice, but I'm trying my best. So help us solve the big hairy problems, right? So, I mean, we just touched on data privacy. One is really making sure that we implement the highest standards. And, as a pharma company, we're well aware of our bad rep. And so the way we answer to that is to be like ultra conservative and super compliant in manufacturing and distributing our medicines. And so we expect the same standards in digital health for our solutions, right? And so one thing is to kind of making sure these are implemented, but then the other side of that is communicating them out there, because just because we know that we are fully compliant and correct and everything doesn't mean that everybody else knows. And actually there is still a lot of bias around about safety and data privacy in the cloud. So help us together to kind of educate people about around the rigor. So I would say that. And then also, I mean, my team knows that data privacy regulations, we think, GDPR, HIPAA, but actually we see that every country interprets them differently. And that's really, really difficult if you're trying to scale agreements or projects across the world. And so also kind of your help on fighting that battle and helping also the emerging data privacy frameworks a little bit, converge. I think that would be more than I could wish for.
Well, then maybe Eric, from your perspective, you got a lot of listening ears. What advice can you offer from Mayo's perspective on any advice that you can give to technology providers?
So I think, the providers, they buy solutions, right? Like most of them don't have the expertise to build things. So I think that's a question that every technology company has to say is, how far do you go up the stack? Maybe you have an ecosystem that goes up the stack, but I think providers they don't buy building blocks, they buy solutions.
So, Richard, I know we've got, the Living Health platform is about, data-driven personalization, either using that as an example or anything else. What do you think some of the current challenges are to making personalized medicine actually a reality for patients in the near term?
Yeah, I'll actually pick up a little bit, Eric, where you left off, because I do totally agree with you that the kind of model of, well, here are the Lego bricks or building blocks or whatever term you want to use, now you use them to translate that into end-to-end solutions is challenging in healthcare. And, so our kind of construction of the Living Health Dynamic platform, we've been, fortunate in terms of being able to, work with various partners to accelerate that time to value, because, we need to be able to put those to work in order to deliver meaningful impact. And I think that's really important, trying to figure out how to reduce that time to value and how to put the amazing pieces together in a way that solves the real world problems. And I think, especially at least with our clinicians, we really just need to make sure that that's what we're doing, right? We're there to make their lives better so that they can serve our members and patients better. And so I think being able to understand that and respect that and be humble enough to kind of say, well, we don't have all the answers, but how can we put these tools to work in order to create some of those solutions would be my answer.
Well, David, you look like you were about to raise your...
I think, wholeheartedly agree. I think what I'm also just thinking about is like, at least at Q, we're always like thinking and bringing it back to like the consumer and the patient, right? Like I think it's, many times when we think about personalized medicine and we think about, the cloud and all the, complexities of healthcare, it's very easy to get into like the tools, the compliance, all the things, which of course we need to do. But in the end, we're serving our patients, and we also have to think about how are our patients or our consumers experiencing all of this? Because personalized medicine, with it comes a huge amount of data, right? And a huge amount of data where we have an obligation and responsibility to make it simple for them to use our products, to access, our services. So it's something we really are thoughtful about at Q, and something that we really think about, when they engage with either our product or our services, and just making it very clear, what data is there? What does the data mean? And what are the things that can help empower them to make healthy choices?
So I know, David, you've joined the company relatively recently, so you're welcome to pass this question on to anyone else. But since we're talking about near-term realization of personalized medicine, how does Q measure that, or any of your organizations? How do you measure? What are your KPIs for that right now?
KPIs for personalized medicine.
Yeah.
It's interesting. I mean, I think I don't know if we have formal KPIs, on it, but we very much look at getting feedback from our users. We look at a lot of different metrics about how seamless experiences are when they engage with both our products and also our services like QCare. And we look at whether or not we're seeing that they're getting the personalized treatment that they're looking for.
Yeah, I mean, once something is in market, I feel like adoption and retention numbers don't lie. So these are some really hard data that we can point to, and of course also customer feedback and eagerness to expand collaborations. Before that, it's really hard. I think what we're also struggling is that's not our core business, right? Digital health. It's always, and so we're always thinking about how can we demonstrate that this makes sense for us as a company? And I think that's where we still have a lot of work to do in understanding how do we really capture the success of what we're trying to do.
Anyone else?
I'll just quickly, I agree, I think the emergence of a real healthy obsession around both continuous and sustained engagement on our platforms is a bit new for us, and I think really important. And then also really understanding the experience portion of that. How do we measure it, and how do we treat that as important as some of the other metrics that we would more traditionally look at? Again, really important for us. And they complement, of course, ultimately the outcomes we are looking for are improved health outcomes, but kind of along the way, these other things kind of tell us we're doing it in the right way through kind of making it more personalized.
Fantastic. Well, along those lines, right, we're not doing any of this alone. So maybe, Leslie, I'll ask you first, what responsibility do you see that regulatory bodies have? Because they play a big role here in the future so that we can become much more proactive instead of becoming reactive to patient care.
Mm-hmm. Yeah, I would expand the question because to say not just what responsibilities regulatory body has, but what responsibility do we have to help regulatory bodies, mature their frameworks and et cetera, because frankly, it is a completely new industry. It is very different from pharmaceutical treatments or physical medical device. So it is normal that it will take a little bit of time until the regulatory frameworks mature, reimbursement, data privacy. And so I think we're trying to figure out we're not just leaning back with our arms crossed and why are they not faster? But how can we get in there and really help co-create and find solutions together, because we all hold, one piece of the puzzle and we can help each other along. And, as an example, to enable access in South Korea for our comprehensive genomic profiling treatments, we actually struck a partnership across the sector, public-private, with the South Korean government, but also healthcare institution, to enable access for the 250,000 of newly diagnosed cancer patients in South Korea, covered by the national health system under reimbursement. And that was so successful that now neighboring countries are trying to replicate that framework in their countries. And I think just by getting into the game and sharing the responsibility, that's how you really accelerate the maturity of the frameworks.
Well, I know that Q has a lot of experience here, so I'd love to hear from you, David.
Yes, yeah. I mean, I completely agree about, it's really about open dialogue between, industry and regulators. And I think really with one thing in mind, which is in the end that we're helping patients and we're trying to make, move healthcare forward. It certainly is a brave new world now, right? With the pandemic, as well as just many technologies moving to non-traditional settings, like the home or other places of point of care. compared to, traditional healthcare settings. And so I think that, and we've seen that regulators have embraced, this change and started to have like really healthy and good dialogues about what does that mean in terms of changes to, traditional frameworks, changes to understanding, what does safety and efficacy mean, in terms of these new environments and new types of use cases. So I think that it really is about, again, open dialogue.
Fantastic. Thank you. And I know we can't have a panel about personalized medicine, comparing it to precision medicine, if we didn't talk a little bit about genomics. So maybe let me ask, what do you think, and I'll start with you, Richard, what do you think the reimbursement landscape looks like right now? How long do you think it's going to take until we actually see routine clinical reimbursement for whole genome sequencing in a provider setting or in a clinical setting?
Yeah, so the landscape now is for at least whole genome sequencing. I think most private payers would see that as a kind of investigative and wouldn't be covered. We do see whole exome sequencing covered with certain kind of guidelines around that. So board certified geneticist, clear documentation how it's going to alter the treatment path with the patient. Today, often deployed, as I'm sure many know, with kids that end up with kind of poor outcomes or with tough diseases, obviously. In terms of when we would actually see broad-based coverage for whole genome sequencing, I mean, I think anything in healthcare, it's probably better to say longer versus shorter. So that's
probably
a
little bit of a cop-out answer.
There's obviously been a lot of incredible advances kind of in sequencing for tumors and oncology. I think if we're trying to think about efficient administration of benefits, we'll see more and more there, for sure. But when do we get to kind of broad-based coverage? I think a lot of really tough questions have to be answered before we get there. Portability is a huge, question from an insurance perspective. So how do you think about that kind of traveling with the member patient? Obviously cost is a question, the cost benefit. And then finally, I think really how is that, the kind of bioinformatics around making that really actionable kind of in the treatment pathway is really important. And I do think the more that becomes evident, I think, people will kind of migrate to that. But I do think it's going to be, a while. I don't think it's kind of imminent, although it does feel like I see more of these conversations occurring, certainly, than less.
Sure.
So the momentum is headed in that direction.
Well, Eric, I know there's some countries that are doing this actually already, right? In Europe, there's a few countries that have adopted this. What do you think are the barriers really to make this a reality here?
So I think you need to communicate really clearly what clinical use cases it's valid for. I think getting a battery of tests is not a great thing. So, making sure that there's the right education for the providers to know this is a logical test. I think that's really important. And I think, just the workflow integration's been brought up so many times. Like, how do you make it action-oriented? Like, make it easy for these people that have just very little time with these patients.
Yeah, fantastic. Well, now we're going to enter, if we have some time, we might take some questions, but we will enter a bit of a lightning round. So I'm going to ask you to try to keep the responses maybe no more than a minute, in a few sentences if possible. And just for fun, Leslie, I'll start with you. What do you think are the critical factors in achieving health equity in personalized medicine? And we'll go around. We'll start with you, Leslie. We'll go to David, and then Eric, and come back to Richard.
Yeah, I think just great panel just before us on that topic. I would say intent, deliberation is really, really important. You actually have to do something about it because it doesn't happen by choice, right? So if you co-create with customers, you make sure you have a diverse set of customers. If you're doing market research, make sure you have a diverse set of respondents. If you're doing clinical trials, don't just go to the most prestigious clinical trial sites that we're in established relationships with, but include community centers, include underserved communities. And then if we think about our solution, we actually see a digital divide, not necessarily in the availability of a cell phone, but more in how old is that cell phone and how old is the operating system on that cell phone, and just making sure that we serve older operating systems, that we have Spanish language included. These are things that we're trying to do.
Sure. David?
Yeah, I mean, I think that for us, it's really about democratization of data. And particularly, we're passionate about doing that for diagnostic data, allowing people to access, their own health data anytime, anywhere, but also being able to utilize, the platforms to be able to offer that in non-traditional settings. Like I kind of talked about that before, right? Where instead of having everyone go to, centralized area healthcare settings, which, we all know are very overloaded in terms of resource constrained, being able to offer that at more point of care, and also ideally in the home or other places that people can access their data is incredibly important in order to, help support.
Fantastic. Eric?
So the promise has been you get the best treatment regimen plan for your omics data, right? And so I think there's lots of buzzwords like digital twin, like we use digital twin at Mayo, like there's a digital twin for cardiology, there's a digital twin for neurology, there's a digital twin for everything. So I think, but really it's diverse data, right? Because I jokingly say the Mayo Clinic in Rochester, Minnesota has a lot of Norwegian, but does it have representation for Native American, right? So the diversity of the data, because if we are going to rely on this digital twin concept and say the omics provides the right answer, you've got to make sure you've got the right diversity.
Has to be reflective, of course.
Yeah, that diverse data is definitely, I think, a solid foundation. I'll just say, three quick things. I do think customer centricity, access, and then community. We have to kind of get into the community to trusted advisors as well to make this happen.
I'll start with Richard. Ready?
Yeah, sure.
Okay.
I don't
So
know.
we're actually we've been talking about it from our perspective, right? From the healthcare, from the industry perspective. What do you think, from a patient's perspective, will be the first or the biggest impact of realizing a personalized medicine situation?
I think it's going to be the closing of the gap between what people experience kind of in many other aspects of their lives and healthcare. And I think the divide there between, everything else that I do is kind of easy and simple and personalized to me. Why isn't, probably the most important thing? And so I think that is going to be, kind of the experience. I don't think, and I think it's going to be just, expectation realization that is going to be the first thing.
Yeah. Leslie?
Yeah, so, when you're a patient, you would think the thing you care most about is improving your clinical outcomes, the efficacy of your treatments, or you're healthier at the end. But I think what patients will realize first, and maybe will even be more dominant in how they experience the benefit, is really the convenience that they get through a better system, the customer centricity towards them, and that increasing quality of life, because they don't have to ask their caregiver, their son, daughter, to take a day off work and drive them somewhere. And so I think that's, we as scientists, we always think like, they'll have better efficacy. But I think what the patients will realize, wait, this is way easier now.
Sure.
Yeah.
Sure. David?
Yeah, I definitely on the convenience, but then also consumers, I think, really want clear, actionable paths, right, that are personalized to them. And it should be, I think that the first thing that they'll, we talk a lot about risk and percentages and, large clinical trials, but, and those things are important, of course, but for a consumer who wants to know, okay, what's going on with me right now, and what should I do next? You need to have that clear path, drawn for them. And I think that's one of the first things that it's like the sun, shining through the clouds. Like it's a very, enlightening moment.
Fantastic. Thank you.
I think I'll look at it through the lens of like serious and complex disease, because that's what Mayo's focused on. When somebody gets bad news, their first reaction is, do I get a second opinion? Do I? And I think if you could go to them and say, out of 10 million patients with these exact characteristics, 85% responded in this way. You're cutting down so much cost and expense if you do this correctly.
So without having rehearsed this at all, right, I would say that, the theme that I'm hearing is an empowered patient is going to be one of the first pieces that a patient will see as a realization of this goal. All right, I'm going to change it a little bit. So we'll start with Eric. What is the origin of your company name? Let's talk about that.
So, there obviously was the Mayo founders, so it's very simple. I think maybe a lot of people ask me, there's 3 shields in our logo, and that represents the practice, the largest one in the middle, so that's what people know Mayo for, but we also have a school of medicine, we also have a whole research arm, so a 3-shield mission.
So as I mentioned before, at Q Health, our mission is to empower users to live their healthiest lives. And what that means is to empower them to change and develop great health habits. And I think that in order to do that, you need clear and actionable cues to help them make actionable results on their health. And so that's why we are Q Health.
Lovely, thank you.
Love it. So Roche is named after its founder, Fritz Hoffmann La Roche, born and raised in the same little town in Switzerland like myself in Basel. and basically, about 125 years ago, he decided to found Roche because industrialization was sweeping across Europe, and the medical practice at the time was hyper-local. It was cupping, bloodletting, mineral poisons. And Fritz had this crazy dream that you could use the industrialization for the, at-scale manufacturing and distribution of evidence-based medicines. And so, of course, I think many people thought he was crazy at the time. But of course, the rest is history. And I think he would be really proud of us looking at this room today.
Of course. And Richard.
Yeah, so thank you for asking. It was fun. I actually had to do a little research. I will admit it. I'm going to admit it. I didn't know the answer. So in the mid-'90s, PA Blue Shield and Blue Cross of Western Pennsylvania were coming together. And the question was, well, what to call that entity? And so there was actually very interesting kind of both a lot of work to generate the support for the 2 institutions coming together, as well as a lot of research being done to say, well, what could be a name that would both fit with the kind of a Blue Cross Blue Shield Association guidelines and represent what the company wanted to be. And kind of out of that was born Highmark. In terms of both institutions had a long legacy of getting high marks in a lot of the outcomes, products, and customers they serve. So that was the kind of pretty simple answer to what was, I thought, a fun question. So thank you.
I made a mistake once and I asked this question without giving this as a prep question, and that didn't work out so well for me. So I'm glad that we gave this question in advance. Yes, of course. Well, so as we wrap up, maybe, we are representing from across the industry, and we're talking about a really hefty topic. So if you could leave the audience here with one thing that you want people to remember from the conversation, the dialogue that we're trying to have with each other, what would it be? And Richard, I'll start with you.
I would like everyone just to leave, and I think just reflect on the fact that there is such a customer focus to not only this conversation, but frankly this and most of this conference that I've been walking around, which I think is amazing. And I know that I end up, with my colleagues getting so in the weeds of all the details. I think David, you said it very well in terms of the complexities that we have, that sometimes we forget that at the end of the day, it's all about kind of the simplicity that we can deliver to someone, especially in times when they really need that. The last thing they need is more complexity.
I would go with collaboration. This is really only achieved in collaboration, and that's healthcare, tech, public, private, across markets. There's no room for protectionism. It's really collaboration is the name of the game.
Thank you.
Yeah. I'll just add on to what Richard said, which is that it really is about empowering users. And, we live in an amazing time today with amazing technology, ways to bring data to consumers and health data in a way that where they can take great actions on their health. And so I think it is about bringing it back and remembering that in the end we are empowering them to make to live their healthiest life.
Yeah, I'm going to go with collaboration. I think it takes the entire group up here, from discovery to delivery to payment to to move this forward.
Well, fantastic. We are actually right on time. We're not getting pulled off of stage yet. But I will use this to keep us on time and say thank you to everybody and thank you to our panel. It is so amazing to see truly the collaboration happening with folks agreeing to be on stage together. So thank you so much. Thanks.